Good morning. We are called Bionavinska Ministries, BBM. So every last Friday of the month, we normally have an activity or an exercise where the rest of the team, both the medical team and the non-medical staff at BBM Bionavinska Ministries, come to join us plus the rest of the other volunteers to join us on an exercise which we call BBM Volunteer Day. It's a day that normally happens every last Friday of the month, and then we go out into the field and then do various activities in the line of promoting primary health care or public health to the beneficiaries, the 85 beneficiaries in Nachisunga that we serve. So today we are going to meet two households that are vulnerable or that are desperate, and then we do a wide range of activities that include building dry racks, digging trenches, slashing around their bushes, washing for them clothes, laying their beds, doing their utensils, doing their windows, counseling them, most of them that have issues that are related to or family issues, or they were neglected by their families, perhaps they stay alone. Like you're going to find out in the field an old man of close to 60 years but stays alone into the house. So those people that need counseling grow up with counselors that are not really medical, but they are specifically they are counselors and they help us into that part. So basically that is what we are going to do out in the field. So we are going on a journey that most likely takes around 30 to 45 minutes, and then when we get there, we do those activities. Kuruziwa. Osura yote sasa.
Jituze mbole tu.
Mr. Zua is one of the 87 clients that we have in Bionavinska Ministries. We began our service in Mukono district in Nachisunga sub-county. And in Nachisunga sub-county we have 5 parishes that we serve. So amongst those 5 parishes is where we find Namaiva parish. And the village that we are to currently is called Katuba village, where we find a total of 16 clients that are above 60 years. So amongst those 16 clients is where we find my Jaja here, Mr. Zua. So Zua is currently a 61-year-old who stays here permanently. Zua was captured into the project right from the initial stages of the inception of the project called Home Health Care for the elderlies. And that was in 2007, the month of June. So we began right from community entry. We entered the community, we looked at the profile of the village and see how many elderlies do we have. We worked hand in hand with the opinion leaders, that is the chairperson, the religious leaders. So they took us to every household that has a person who is above 60 years and is in such a vulnerable state like Mr. Zua. So Zua was entered directly into the project as an entry, direct entry into the project. So we began right from June 2018 to take care of Zua's health. Because basically Bionavinska Ministries is a healthy related project. However, we have a social aspect of it and then a spiritual aspect. So we pray with the old people, we pray with them, we praise with them together when we meet them. We support them socially, and then we also do counseling with them. We have counselors on board, and then we do the core product of offering healthy services right from the homes of wherever the old people are. So Mr. Zua was found according to the history. You can see him seated there, but he can barely walk. He's disabled. He got a disability in 2016 as he was walking on that lane. As you can see that Madam stretch. So he was coming from the township, the nearby township in the night, and he happened to fall down. I think it was a slippery road, so he fell down. When he fell down, because of the financial state or his standards of living, he could barely go to the hospital to access a health service. So when we captured him, he could barely get out of the house. And then what we did was to start immediately by offering healthy service support. So we thought when we buy clutch sticks or walking aids, we could support him in that way. So we bought walking aids. I think my colleague can help me bring the sticks. The walking aids that we bought for Mr. Zwa. So we thought it could help him to try to mobilize, but it couldn't. So we had to come back again as Yonavinska Ministries on our routine visits, that is bi-monthly visits. And then we took him to a certain hospital in Kampala. When we took him to the hospital, so these are the walking aids that we brought for him to start make sure that we see him getting to walk, to try to walk with some people helping him around. So we went to Kampala and we did an X-ray. When they did an X-ray of the waist, it was found that he got a fracture of the hip, but then the bones united wrongly, which we call malunion in medical. So when it united wrongly, he could barely get help. So we brought him back, and then we started physiotherapy. We bring a physiotherapist and help him around. We bring counselors and help him around, as well as do the routine bi-monthly visits, medical visits. So we currently treat him of pain, because normally he complains of pain into the waist, because he's always seated, or lying, so he cannot walk, and then that puts a lot of pressure onto the nerves. So, and other things that can come along. You can see him, he wasn't that size. Most of the people that he used to socialize with, they say he wasn't that size. So he has emaciated a lot, or he has gone thin. So we also thought that he could be probably having HIV and AIDS. When you look at him physically, when he just came, that's what our mind actually as the medical team, when we met him, we thought maybe he's a victim of HIV. So we took him to the nearby HIV clinic, special clinic for HIV. They did an HIV test, and fortunately enough, the guy is healthy. He's not positive. Yes, so we were happy with that. We brought the results and we have them into the office. His file in the office has the details of his health status. So he's a negative guy, but just needs support. Social support, counseling, rehabilitation, and then medical support like what we are offering. So today, being a day for the volunteer day, we decided to come with the rest of the team like you have seen them. And we found there was need to support this guy. But then when we got into the house and then the environment around him, we figured there's extensive need. He doesn't have a pit latrine. He doesn't have even his house like you can see it. One time maybe it can even land on him. It can fall on him in the night when he's sleeping, when it rains. The floor, the mud floor, everything around him needs support. So currently we can do our best as Yonavinska Ministries, is that we have offered with the team. And we would kindly request, in case someone would come in and close the gap from wherever that we have stopped and support us, so to support Mr. Zwa as well. So I thank you so much, and I thank the rest of the team overwhelmingly for the work that they have done today. God bless you.